Good afternoon, everyone. Welcome to the monthly Ohio Legislative Children's Caucus webinar. As you know, this is a bipartisan, bicameral caucus, and we talk about the issues that are important to Ohio's children and families. My name is State Representative Monique Smith, and I'm just thrilled to be here all the time, every time we get together with all of the experts that we bring together. Today, we're going to be talking about skills-based health education to support a healthy Ohio. And the reason we need to talk about this is because, as it turns out, Ohio is ranked 47th nationally in health value. And Ohioans, unfortunately, we're seeing that Ohioans are living less healthy lives despite spending more on healthcare than people in most other states. We have rising rates of preventable chronic disease. We have increasingly widespread youth mental health issues and other public health challenges that are taking a significant emotional and economic toll on our children, their families, and our state economy. Ohio can be a leader in public health, however. We just lag behind other states because of too many missed opportunities for upstream prevention in our policies and programs, especially for children, to avoid health risks as they learn, grow, and develop. And that's why we've gathered 3 experts today to discuss some health-related initiatives. We're talking about health education, and we have Kevin Lorson from Wright State University. We have Jamie Sparks from the Kentucky SHAPE program, and we have Holly Raffel. And with that, I'm going to hand it over to Kevin Lorson to start off the discussion and introduce us a little more in depth to the rest of the panel. Thank you all for being here. I look forward to the conversation.
Thanks, Rep. Smith. I'm going to introduce myself real quick. I'm Kevin Lorson from Wright State University. My position is teaching health education and physical education to future teachers. Holly, if you can introduce yourself next, and then Jamie, remember to unmute yourself and introduce yourself just real quick. Holly?
Absolutely. Hi, I'm Holly Raffel, and I'm from Ohio University's Voinovich School of Leadership and Public Service. And I also am the faculty director of Ohio Center of Excellence for Behavioral Health Prevention and Promotion.
Good afternoon, everyone. My name is Jamie Sparks. I serve as Kentucky SHAPE's executive director. We are the state affiliate, similar to OAPERD in your state. And so we are all state affiliates of SHAPE America. And I also was the 2020 president for SHAPE America as well.
Thanks, Jamie. If we can go to the next slide, just a quick overview. All 3 of us are going to take up a bit of a section today. I'm going to overview health education in Ohio, make some connections to the Ohio Whole Child Framework. Holly's going to take a chance to make some connections to public health and health education. And then Jamie's going to talk about what health standards do for the state of Kentucky. So we'll take a chance for all 3 of us to have a spotlight on those 3 issues. Just to set the stage and the why, I think I looked at the participants list real quick, and we have many of friends out there in education and working in health. And so this first slide is something you already really understand quite well, is the interconnectedness between education and health. We know that healthy kids are going to increase our education outcomes. We know that if we increase our education outcomes, that leads to greater health. And so we must continue to work in both realms to support successful students that can meet their fullest potential. We also know the importance of schools in their communities, that schools are kind of the hub of activity, but a lot of that work's been siloed, and sometimes schools work separate from their communities, but we've done some work in the state of Ohio to build those bridges, to make connections between schools and the communities and the students and families that they serve. Next slide. So just some basic examples, and we know the opioid crisis, how that's impacted our families, children, schools, and communities. We do know that it has a great impact on academic outcomes, but we also know the direct and indirect effect of trusted adults around us, and families and schools and communities can mitigate that. And we've already mentioned a bit, Rep. Smith mentioned about the impact of mental and emotional health on our schools and our students, as well as we know that healthy students who are physically active and eat healthy also can improve education outcomes. Next slide. So while we're here today to talk about health standards and the fact that Ohio is the only state without state level health education standards, we do have something that's unique to many other states. We have a whole child framework. So what the state did a few years ago is ODE created Each Child Our Future, which is the state strategic plan. And you can see in the middle of that, it says whole child, and it was one of our 10 priority strategies. Kind of alongside it about the same time, the Ohio Whole Child Framework was created, and I'll talk more about that specifically. But really the goals of Each Child, Our Future and the Ohio Whole Child Framework are mirrored in terms of we want students to achieve their highest level of success by being healthy, safe, engaged, supported, and challenged. And we know that there are many state initiatives that work towards that goal. So while we're working with student wellness and success, K-12 prevention, social emotional learning, trauma-informed schools, all of those initiatives and all those resources and all those supports are really targeting healthy, safe, engaged, supported, and challenged. I've already mentioned those 5 tenets, so if we can go to the next slide. Those 5 tenets are really important. And as I've shared this work and as the department has shared this work in a number of different realms, there are initiatives that we do within school that might even impact multiple tenets. But again, our goal is healthy, safe, engaged, supported, and challenged. And I'm sure my school friends that are on here, my teachers, my administrators, if you give me a school full of kids that are healthy, safe, engaged, supported, and challenged, you would really see how well we could do in terms of our academic outcomes. So again, our main outcome, again, for schools, healthy, safe, engaged, supported, and challenged. And that challenge piece really speaks to the academic piece, but also even those extracurricular and co-curricular opportunities to advance our success. So within the Whole Child Framework, just to give you a 3-minute overview, but again, there's lots of resources out there. Some of them have already been shared in the chat box. It's grounded in systems thinking, systems change. I've already heard the word today, upstream. It thinks with a prevention and upstream focus. And again, the key elements are about building councils, liaisons, and teams that are focused on the 5 tenets and coordinating policies, programs, and practices that will benefit our students. Next slide. A little bit about the first ring of the Whole Child Framework. So again, the tenets are inside. The second ring that connects all the components together are the ideas of equity, cultural responsiveness, continuous improvement, and coordinating policies, programs, and practices. So these principles and practices operate amongst all 12 of the components that we're going to talk about in just a second. So for example, equity and cultural responsiveness would be integrated in physical education, health education, social emotional learning, and even as we think about behavioral health, or even our school climate and culture. And a really important piece isn't necessarily about doing more or having lots of programs and practices, but coordinating those policies and programs and practices that we do have within our resources. Next slide. So there are 12 components. Originally, there were 10 components in the whole school, whole community, whole child model that was developed by the CDC and the ASCD. Ohio added a couple of components, social emotional learning. They also renamed a couple. They also added school safety, but we also renamed a couple of components also. But if you look here, there's 4 different shades of blue. At the top is the realm that I work in primarily and kind of the focus of today, which is healthy behaviors. So that's physical education, health education, and social emotional learning that work together to develop the skills that'll lead towards healthy behaviors. Around the clock, the next color of blue there with school and child nutrition, health services, and behavioral health. Those services work together to provide, whether it's community, co-located, or school-based resources to improve healthy, safe, engaged, supported, and challenged kids. The next category, the darkest color of blue, is family engagement and community involvement. That includes parent education activities and ways that we can involve our community, whether they be health fairs or specific activities that we can do to engage the community and families in the work that we're doing to support the whole child. And then the lightest shade of blue is the healthy school environment, and that's just school safety. Again, the Attorney General has lots of work and resources for that Center for School Safety, the physical environment, school climate and culture, and then also staff wellness and self-care. And collectively, that school environment supports healthy, safe, engaged, supported, and challenged kids. And you can see there's lots going on, but the key piece is to coordinate those policies, programs, and practices across those components. Next slide. And again, a key piece of this is also the support that we receive, the reciprocal relationship between families and communities. Our communities and family influence the work that we do within the school, but also understand creating healthy kids and the school operating can be influential in helping support healthy behaviors and healthy families and healthy communities along the way. So we're off to a good start in Ohio, and I think if we can take that whole child lens, that whole child framework lens, it'll really help us moving forward, in particular in producing healthy outcomes. You can go ahead to the next slide if it's okay. So in specific, what is health education? And health education for us is that planned learning experience, typically led by a K-12 health education curriculum that's focused on developing functional skills, functional knowledge and skills to impact healthy behaviors. We would like, the recommendation is to have daily health education in grades K through 12, but we really struggle with that actually across the country. Not many folks are providing K through 5 health education. We see limited offerings in middle school, and most of our kids get health education in 9th grade, which I'll show you in just a second. Next slide. And I think most of our folks on the call today already know that much of what we see with health education in the state of Ohio is outlined in ORC and 3313.60, which talks about the prescribed curriculum. So the prescribed curriculum tells us a lot about health education. It also talks to us about physical education. It also outlines some of the things that we have to do for graduation requirements. And just to clarify, in health education, students are required 0.5 credit, which is 60 hours of instruction. And in physical education, they are required 0.5 credits, which actually equals 120 hours of instruction or 2 semesters. But there is that waiver that still exists for physical education that lots of students take advantage of. So there aren't as many students taking physical education in high school as they used to in the past. Next slide. The health education requirements in the state of Ohio. Again, the only time requirement is the 60 hours in high school. In K through 8, there is no time requirement, but all schools and schools specifically, that means something. A school within a district must have a health education curriculum that includes the requirements. And as you can see, our state is heavy on topic requirements, from nutrition drilling all the way down to food additives to 30 minutes of instruction for anatomical gifts or organ donation. So you see that we're kind of heavy in requirements of topics to teach. On that list. You can go to the next slide. And while we're heavy on topics, as you can see from this map, we are the only state without health education standards. So I met my goal almost in every presentation that I do. I relay that comment that we're the only state, but we are unique in that aspect. And so part of today is to talk about why health standards would be important and how it would support us. So next slide. Some of the other things, not only having the only state without health education standards, we're the only content area in Ohio without academic content standards. The General Assembly has oversight of health education, not the Department of Ed. There is no specific health education consultant at the Department of Ed. They will help out if there are questions or concerns, and they do help make sure that folks are compliant with ORC, but there's really not much support from the Department of Ed within health, since the General Assembly has oversight. And again, last year, the General Assembly banned ODE from publishing model curriculum in health education. Next slide, please. This data is from the 2018 school health profiles. And as you can see, it outlines the percentage of schools that taught a required health education and physical education course. Physical education in red, health education in gray. I've made this statement already today. As you can see, most kids are getting health education in 9th grade, with 71% of schools, followed up by 10th grade. You can see a smattering of offerings, but less than 50% of schools are offering health education in the middle school grades. And you can see there isn't much there in 9th or after 9th grade. In 10th, 11th, and 12th, there's not much going on in terms of offering courses. And we do see that physical education is offered more frequently than health education. And just to remind you, Ohio does have physical education standards, and actually we are probably the only state that requires assessments in each grade band that are reported back to the Department of Ed. So that's an important point to make here. Next slide. Along with the comparison between physical education and health, when we asked folks when they last updated their curriculum, I did a study with Holly and a few folks from OU a couple of years ago, and we asked folks, when was your curriculum last updated? And it's pretty troubling that about 69% of the state, either it's been updated more than 5 years ago, or they have no idea where it's at. So really, we've got some problems going on in terms of curriculum. And if you make the comparison between PE and health, you'll see that there's one big difference between physical education and health. It's taught by some of the same people. It's a curriculum development process that's the same between health and PE. The biggest difference is we don't have standards in health. And so you can see that physical education, we have curriculum, we have learning outcomes, we have a scope and sequence. In health ed, more than likely we do not, which is problematic. Next slide. So we have all these requirements and expectations for districts, but we do little to ensure that districts are developing a local K through 12 curriculum that represents the needs of their students, families, and communities. And so we also have a disconnect in terms of professional development. Many of our health education teachers have not received professional development in those required topics, or any health education for that matter. So if we go forward one more slide, what do these health education standards look like, and why are we passionate in terms of advocating for them? Health education standards provide guidance. In particular, in health education, it identifies the functional knowledge, the key concepts, and then the skills that kids are going to need to demonstrate healthy behaviors. So as you see here, here are the first 4 standards, whether it's key concepts, which is really that knowledge piece. But then from 2 through 8, you're going to see the skills are analyzing influences, accessing valid health resources, demonstrating interpersonal communication. And then if you go to the next slide, the last 4 standards relate to decision making, goal setting, demonstrating self-management skills or health enhancing behaviors. And then number 8 is advocacy skills, but not advocacy in the way that we think about it in terms of government relations. It's really encouraging others to demonstrate healthy behaviors. So the important concept around these standards is that it outlines skills that are essential and those skills that can be applied across all topics. And just a reminder, when we're thinking about what standards mean, standards guide the planning process. It lets us know what's important and what to expect in each grade level, and actually the outcomes from a K through 12 approach to health education. So it sets the stage for developing a local curriculum that would include learning outcomes, assessments, and a scope and sequence for what to teach and kind of when to teach it, but yet also giving teachers a little bit of flexibility to manage what's best and present a curriculum that's best for their students. I think the other thing that happens with the standards is that it provides opportunities to seek co-curricular and extracurricular opportunities to make connections throughout the curriculum, as you can see, or throughout the K through 12 experience. As you can see, kids are not interacting with health education or even physical education after 9th grade. So we need to look for opportunities, and that would be within things like co-curricular within advisory or SEL opportunities or prevention activities where we might be able to reinforce that whole school, whole community approach to developing healthy behaviors. And one more slide before we get to Jamie is just an example here of a skills-based health education lesson. This actually came from the HOPE curriculum, which is that K through 12 opioid prevention curriculum. So I'm going to pause for just a second, let you read that scenario paragraph, and then let you read the discussion questions below. And I just want you to think about what are the skills that we're developing in this scenario and how might this help a student demonstrate healthy behaviors. So in this lesson, what we'd start to do is we would facilitate a discussion or have some students work, especially in number 3 and number 4. But really, when I show this scenario to folks, they're like, is this really substance use prevention? Because this sounds like it could be mental and emotional health, and I might have a friend who might need support and assistance. And so when folks ask the question after I show the scenario, it really reinforces the importance of skills. It's not necessarily the topics that's important here, but the idea of recognizing when someone might need support, and that's using our key concepts or functional knowledge, but then using the concepts of empathy and developing our communication skills to write out what we would say, and then also accessing resources that we can use, whether it's in our school, whether it's in our community, or people that we might trust or trusted adults that could help a student. So these skills apply across many topics. Next slide. So that's a quick overview. You're already probably tired of listening to me. We're going to give it over to Jamie here in just a second. Jamie, what I'd like you to do is initially start with this idea of what are health standards like in Kentucky? How has it helped your students, your teachers, and your schools? I've kind of overviewed what it might look like in Ohio and how it's helped a little bit, but I'd love to hear what Kentucky has done with their health standards and how it's benefited folks.
Yeah, absolutely. Thanks, Kevin. Kevin, I know there's a slightly big football game this weekend, so I'll actually start with a football analogy, if you don't mind. Imagine you turn on the TV at noon on Saturday and you're watching the game there in Happy Valley, and you notice on the field there's no goalpost. And that would be kind of confusing because you know what goalposts are for and you know the purpose of those in football. And that's essentially what state standards do. And so here in Kentucky, we have a goalpost for health education, and we don't tell kids, schools how to kick that ball, but curriculum and local decisions and all that still comes in play. And we're also, as Kevin said to that map, all other states have goalposts for health education, and that's that consistency. And so it really is important to set that framework. We updated our standards. I was at the Department of Education. I served as our coordinated school health director from 2010 up until 2018. And so one of the last things we did in 2018 at the end of my tenure and grant cycle there was we updated our state standards. And a lot of that was complementary to the process that we had begun through the Every Student Succeeds Act. And ESSA really allowed us some opportunities to think more holistically about education and about outcomes, to really put the focus on student success. So it allowed us to do a lot of things related to the whole child, to look at measurements around opportunity and access. One of the key things that ESSA did as compared to No Child Left Behind and all the other previous federal laws is it included health and physical education as a part of a well-rounded education. So those areas are now eligible for federal funding. So that is one of the new things with ESSA. And so we wanted our state standards and update process to be complementary to what our constituents said around the state when we did our town halls and developed our ESSA plan. So we wanted health and physical education to both have that same level of priority when it comes to what happens at the local level and continuing to do that. Again, state standards really, and we actually, I didn't just make that analogy up about the football goalpost. We really did talk through the process of the curriculum decisions and the scope and sequence and the curriculum mapping. All those things are locally controlled by schools. So the standards are really a high level process of saying, here's what happens at each grade level or various grade bands and by the end of certain grades. And we certainly, you heard a lot of the data at the very beginning around health outcomes, but the pandemic has also helped us to shift that priority as well. So continue to look. And so you all have some great things to work on and that the whole child framework, but really just the opportunity to further develop those standards so that there's more consistency across what the expectations are for students in each and every school across Ohio.
So Jamie, can I ask you a quick question? How do schools use the standards? So how would they use it? And then my follow-up is going to be, how does the department work in this guidance piece? What are they doing to support schools to go through this process?
With the standards for our development process, we went there, we looked at a number of other states and helping to inform ours. We looked at the national health education standards that are the skills-based standards. And I think that's really one of the big shifts that we're seeing that we want to happen in the classroom. Many of you, if you think about your health ed experience growing up, it was probably a lot based in knowledge and content. And so that is one of the evolutions that we've seen and we wanted our standards to reflect is it's not just about memorizing body parts. It's not just about memorizing classifications of drug, but it's really teaching skills that students can take with them for a lifetime. So we want students across the P12 spectrum to be practicing goal setting, decision-making, practicing self-enhancing behaviors. And so by allowing, by the state putting those goalposts in around certain content areas. So we have a mix of skills and content within our standard framework. And so that way there's some consistency that happens from elementary to transition into middle school and then ultimately high school to help them become the most successful adults that they can be.
So what role did you really play at the State Department of Ed, or what role does the Kentucky Department of Ed do with standards? So kind of outlining for us what it might look like in Ohio if we had state standards. What's the role of the Department of Ed in terms of providing guidance and support to local districts?
All of our standard development processes at the Department of Ed go through the same exact process. We have a visioning committee that helped to lay the vision for the standards. We also have the content piece. And so those were done by local teachers. We worked with institutions of higher ed across our state. And so we went through that process. And then our other content experts that were at the department were also a part of reflecting and helping create consistency among other content standards. The more consistency we have between content areas, we know that the better that's going to be implemented at the local level, especially when it comes to health education, because health education is really taught by a plethora of different people at the school level. So when you look at that whole school, whole community, whole child model, the PE teacher certainly has a big part to do with the health part, but we also know that classroom teachers and school nurses and school counselors and psychologists all play a part in helping to frame that. So the standards allow you to kind of have some high level goals of what should be happening across the whole spectrum.
So I can ask you one more question. I think we'll have enough time for this. What are we kind of missing out in Ohio because we don't have standards? From your role as the Department of Ed, but also supporting health teachers and being around these folks all the time, what are we missing out on?
Well, just looking at what is required, my first reaction, and this is not just Ohio, but it happens other places too. From a legislative perspective, we're not dealing with health by design. We're dealing with health by default. We're trying to be responsive to different ills in society. Instead of saying this is a normal part of what the education outcomes in a school should be, that focus and prioritize on health and wellness, it's like we see legislatures trying to respond to opioids, trying to respond. And by the time we get things done, it's always something new. Instead of just saying, how do we create health as a normal part of a school day for all kids across that full public health experience or public school experience?
Thanks, Jamie. I have many more questions and probably people do in the audience, but we'll have to let Holly talk a little bit. Holly is going to provide great information here in a second, but we'll get back. Hopefully there'll be some more questions for you here at the end. Holly's going to share with you a little bit about health standards and being public health. So Holly, take it away and share with us the role of health standards.
Absolutely. Thank you so much. I am honored to be here today to share some conversation about health education standards alongside Kevin and Jamie. I've had the privilege of meeting one-on-one with many members of the Children's Caucus over the years, so thank you for providing another space for this conversation here today. I started my career actually as a 9th grade teacher at Logan Hawking School District down here in Southeast Ohio. And over the past 24 years, I've had the privilege to advocate for not only health education standards, but this coordination of school health that Jamie spoke to before for a really long time. Next slide, please. These are the objectives that I was asked to speak to today. As we progress through this presentation, please recognize that I believe that mental and behavioral health are health. So if there are instances where you just see the word health or I say the word health, know that I'm talking about all aspects of health and wellness and not just physical health. Again, I believe in that coordinated health approach. Next slide, please. Over the past 2 decades, public health research has well documented the effect of health and well-being, as well as the effect of education on populations. This research has also shown the very powerful interaction that occurs among health, education, and poverty, income, and wealth. Health education standards provide a coordinated approach for students to acquire the knowledge, the attitudes, and skills they need for making health promotion decisions, achieving health equity, learning about health literacy, and adopting those health enhancing behaviors, and also, as Kevin said, promoting the health of others. These skills, when developed early and practiced and reinforced often, not only are good for the individual, but also those closest to the individual, like family members and friends. Next slide, please. So we know that, but it bears repeating, that the behavior patterns we tend to carry with us throughout our entire lives are learned early. I recognize that health and wellness is a cascade of factors, some of which we have control over, which we would deem choices, others of which we have no or less control over. For example, genetic, like the BRCA1 and the BRCA2 genes for breast cancer. Sometimes our health is impacted by situations, such as being in a car accident, or sometimes environmental, like being exposed to toxins at work. Next slide, please. If we take a look at the top 10 leading causes of death in 2020, just really take a look at this list for a moment. As you look at this list, think about how many health-related decisions were made along the way that resulted in those individual deaths being tallied. While it's important to know the facts, the knowledge about these conditions, I believe, and research tells us, that it's more important to have the skills and attitudes to promote personal health or advocate for the health of people we love and care about. If we take it one step further, take a look at this list. As you take a look at it, think about how you could put those skills and attitudes to use in managing all stages of these conditions: prevention, early identification, treatment, management, and recovery. And then for promoting your health in other areas and all the stages of these diseases and conditions. Next slide, please. Nothing kills more Americans more than heart disease and stroke. These diseases cost our healthcare system $216 billion per year, and another $147 billion in lost productivity on the job. Obesity. It affects 20% of children and 42% of adults and puts us at risk for chronic diseases, type 2 diabetes, heart disease, and some cancers. Obesity alone costs the US healthcare system $173 billion a year. Cavities, tooth decay, is one of the most common chronic diseases in the United States. 1 in 6 children ages 6 to 11 and 1 in 4 adults have untreated cavities. 34 million school hours are lost because of unplanned, emergent, or urgent dental care. And that results in $45 billion in lost productivity at work by either people taking their child to see the dentist or taking time off themselves. Excessive alcohol use is responsible for about 140,000 deaths in the United States each year. 1 in 10 of these deaths occur in working age adults, which has a cascade effect, right, on the families that they have as well as their employer. Excessive alcohol use costs the US economy $249 billion or $205 per drink. If you think about those, by choices or by circumstances, the skills to promote health for ourselves or to others is essential to our economy. Next slide, please. Think about the last time that you needed or wanted to change a health behavior. What did you need to be successful? I'll bet it's not more information about that. You clearly know a little bit of information about that because you know you need to change your behavior. What's going to put you over the tipping edge to make that behavior change? Research tells us it's probably knowing why to make that change or how to make that change. Health education standards promote health literacy, and those skills transfer throughout life. So if you're learning those skills early, practicing them often, you can support those changes in yourself. But when you're a parent, you can support and advocate for your child. And when you're an adult child, probably many of us on this call today have had to advocate for a parent or other loved one's health, or maybe even a spouse. Next slide, please. So here's a visual of how health education standards promote health literacy and complements the existing legislation. At the bottom, you see those content areas, and that's kind of underneath the pink block. So those areas would be, like Kevin described, that laundry list of topics, or Jamie said those things that we're often reactive. Something happens, so we add another topic here in Ohio is what we're doing. So those are the building blocks. We have this list of what to teach. And then if you take health standards and layer them on top, what you see is that you get a robust way of teaching that complements the existing legislation. It goes beyond teaching core concepts. When people see this, they know that the goal is self-management and advocating for the health of others, okay, which many of us on this call have to do every day. If you're here, you're healthy enough to be on this call, and you probably have loved ones that you're advocating for as well. And it takes a lot of steps to get there. And that goalpost that Jamie spoke of is all the steps from accessing information and analyzing influences all the way up to self-management and advocacy. Next slide, please. So this graphic is the Swiss cheese model for tuberculosis. And I just chose this one because I didn't have enough time to do a Swiss cheese model for the whole child, whole school, whole community framework. So that's something that Kevin and I will get to work on for future presentations. What's true right now, though, is health education represents a current whole, or in that piece of Swiss cheese of the whole child, whole school, whole community framework. That upper quadrant that Kevin described could be so much stronger, and we could close up that hole if we had health education standards. We also know that the misinformation mouse is also could be trapped, right, by those health education standards, because part of those health education standards is learning how to read information, figure out what misinformation is, so I know what I need to do to protect my health. Closing the gap or closing the hole in health education by enacting standards also it's an investment in now with our current students, but it's also an investment in our future, because if we have generations of students who are able to have the skills and attitudes to take care of their health, right, those become the people in the whole child, whole school, whole community framework in the future. So again, this is not just an investment in today's students, it's also an investment in the future of Ohio. And finally, last slide, please. Ohio is ready for health education standards. Health education standards complement the existing policy that we have. The ORC provides a list and topics that have to be taught. Health education standards provide a clear framework for how topics should be taught so that all Ohioans have access to a skills-based education. Higher education is ready. Faculty from Toledo, Miami, Kent State, Cleveland State, Wright State, Ohio University, and Ashland are the ones I know about that have been involved in state and national conversation about health education standards. Incorporating Ohio-specific health education standards into teacher prep programs should be seamless. P12 education is ready. Health education standards complement Ohio's whole child, whole school, whole community framework. Health education is a key component of that framework, and health education standards will make that framework more robust. Health teachers are ready. The OFRD model curriculum is a resource that provides links between standards, benchmarks, and indicators. Ohio teachers are already telling us they see this as a resource and they've seen the connections in practice. So training in service, those people who are current teachers on health education standards should also be seamless. And community health educators and our credential prevention specialists are also ready. Like Jamie mentioned, what happened in Kentucky, everyone got on the same page of what we need for health education standards and shifting folks to a skills-based health education. These allied health professionals are key partners in the whole child, whole school, whole community framework, and health education standards would ensure that the programs, policies, and practices that they are offering are uniformly aligned with the standards in Ohio. Thanks so much for this opportunity to speak, and I'll turn it over to Kevin for some wrap up.
Thanks, Holly. Just to wrap up, I think our current message in legislation has been more about addressing topics rather than skills, and it really hampers the ability to align our efforts across the whole school, whole community to promote those healthy behaviors. And if you're really looking at the tenets, healthy, safe, engaged, supported, and challenged. And so many districts are either scared or don't know how to build their local curriculum. And I really think a push around standards would help not only convert our teachers to a skills-based approach, but also support curriculum directors, school leaders, and community leaders to engage in the process that's listed here. I think we know the topics that we need to address, but we need our state to kind of reinforce that it's actually the skills that are most important, more so than topics. Topics can really be determined locally by using local data and really looking at needs and readiness for what we need and what's best for our students. If you flip ahead one more slide, there's a list of resources there. They've done a great job in the chat box sharing those resources, and I'm sure they'll pop up again in the chat box. So what we really have right now is our state organization, OFRD, created a K-12 model curriculum that has some learning outcomes, that has a suggested scope and sequence that might be helpful for districts to engage in that curriculum development process. But right now, really, districts are just grabbing at whatever they can to address the topics that have been dictated from the state level. And we're really not having this K-12 focus on developing skills and healthy behaviors. And that model curriculum, just to flip one more, these are the things that are addressed within it, but that would be part of any professional development and support that we would provide districts that are engaging in that process to develop a K-12 curriculum. And by the way, when you're developing that curriculum, it involves your teachers, your families, your students, your community members. It should involve everybody to develop a K-12 curriculum that meets your local needs. And that's the key part of this. So our ask as we wrap up today, from you, whether you're here as a community member, as a legislator, or anybody else that's interested in health standards, I think, again, we'd love to see Ohio get health education standards. We're doing our best to support folks with the tools that we have available, but I think it's really important to have standards. I think it's important for local control. I think the topic requirements actually work against local control. We're told often Ohio's a local control state, but we've really, if we're a local control state, we shouldn't be dictating minutes and time and who's teaching health education. That's a local piece. I do think we have an asset in our Ohio Whole Child Framework. So if we can start to look at and continue to look at health issues using a whole school, whole community approach to see how we can impact students, families, and communities, I think we'll be better off. And I really do hope that we continue to validate and support and value the role of teachers and the work that they do to help support healthy, safe, engaged, supported, and challenged students. And we're doing our best to make sure every student can achieve their fullest potential. So with that, I thank you. I apologize for a couple minutes over, but I'm surprised we didn't go more over time, to be honest with you. So Jamie, Holly, great job. And Hannah, I'm going to turn it back to you to moderate some questions and comments.
Yeah, thank you so much for this really critical debate. Before I get to the Q&A chat, are there any lawmakers who have any questions for the panel?
This is Representative Lightbody. I'm sorry, I'm on a phone and I can't figure out how to raise my hand. So I would say that I'd like to speak on behalf of those of us who are in the State House, who care about education, who very much want there to be educational standards for health. We've tried. I'm in my second term, and I'm a 30-year veteran teacher. I taught science, and I think I taught more health in my science class than anybody else in my school. But I agree with you that this is something that we need to make sure that Ohio is pushing through. The question I would have is what's going to be the most profitable strategy or campaign to get enough of our bipartisan support to get House standards through the General Assembly. Obviously, we won't be able to do it this time. Probably we'll have to do it in the beginning of the next term. I hope to be back and would love to, help with that. But I'd love any kind of advice from anyone about what we can do to kind of help get the bipartisan support we need from legislators who are across Ohio and may not be as supportive as I am.
Hannah, I don't know if you wanted us to respond, but thank you, Representative Lightbody. And you've been part of committee hearings, and there was a comment in the chat box about Rep. Liston, Senator Sykes. Like, we've tried multiple times. I think it's been over 15 years and 6 or 7 attempts, almost every session we've tried. I would agree with you. I think health is a bipartisan issue, and we hope that folks can join us in supporting developing skills. And I think the standards, once you get to know them, there's some controversy that has been, generated around it. But I think if you look at the actual standards, they're probably the least controversial thing that we could pull up these days.
And also I have Phil Height as a constituent of mine and has written curriculum for health standards that are, used across the country. So we certainly have the local expertise we need to, be part of the folks who are going to write the standards, but we've just got to get the State House to agree that we need them.
Are there any other questions from lawmakers or staff? Okay, I'll go ahead and jump over to the Q&A. So one of the first questions was if you could describe the strategy for engagement between schools, families, and the agencies.
So I'll take that one to start, and then if Holly and Jamie, you want to chime in on that one if you have a chance. In terms of engaging families, community, and parents, we think that schools need to engage that whole child framework. I think that's the key piece to consider. How do we bring folks together? And we'd like to encourage folks to make connections to their school strategic plan and those goals that we have, those academic goals. How do we infuse health, safe, engaged, supported, and challenged into those goals? Because we know that if we get those 5 tenets, we're more likely to have the academic outcomes that we want. So I think that's part of the conversation. And whether it's committees or councils, how do you promote that family engagement and that community involvement in the work that you're doing? And probably the biggest strategy is to create awareness. We know, by the way, that just sidebar, most of the information that parents get about health is just sex ed, but we don't share information about how to promote healthy decision-making with substance use prevention, or how to access valid and reliable resources or trusted adults, and even helping parents to develop skills to have conversations with their students or take them through role plays of how they would operate in a situation where they might be out at a social gathering where they might need a ride home. And there's folks that have been drinking. How do I get a ride home? Those are all important skills-based opportunities for kids to learn. And so I think that's part of it. I don't know if Holly and Jamie, you want to chime in on the other piece of that, but how do we connect folks together a bit?
Well, I'll just add, just to differentiate the two as well. the Department of Education is going to have a very prescriptive process of stakeholder engagement, and that's what they're going to be doing, and that's going to include the legislature and a review process for that to go through. So, like I said, in our state, it was specific around our teacher experts that were selected, around our higher ed partners, and then it went through both the State Board of Education and then over to the legislative review. And then for the parental and local community folks, that's really where the curricular piece comes in. When local school districts determine how they're going to meet the standards in the classroom, that's that opportunity for districts to select that local selection process. And again, those are already existing policies and programs that they have in place to do those processes across other content areas as well.
And I'll just add briefly that I think what the biggest opportunity for the schools, communities, students, and everyone to come together through that model is that skills-based health education is good for all of us. Many of you have probably seen the Talk They Hear You commercials on TV about how to talk to your young people about risky behaviors or alcohol use, et cetera. They provide like a vignette, they provide a way for you to see how to have that conversation. They don't just tell you, Talk They Hear You. In all of that pieces, they give you the skills, right, which gives you the confidence to have that conversation. So health education standards, having them in hand, may also then kind of help us turn the volume up a little bit on how we communicate in our letters to parents and our letters to teachers, right? We just follow through. What's good for our students is what's good for all of us. And so that's how I see things working together.
Thank you guys for that one. The next one that we have asks about harm reduction and if harm reduction is included in health education curriculum.
I'll take that one, Kevin.
That one's Holly. I knew that one. Holly gets that.
Yeah, absolutely. Thanks, Monique, so much for the question. So again, health education standards are those broad areas that are building blocks on top of those topics. And so harm reduction would fall under alcohol and other drugs. And that would be a local decision, right? And so I think what's important is that we have a way of teaching young people as part of AOD that there are things to do to help in an emergency, right? And so that would be the resources and advocacy, but that would be a conversation that would happen at the local level through the whole child, whole school, whole community model. And so people could be at the table and saying harm reductions are really important and we want that in our curriculum, but that would be something totally separate from the standards. Would mean that we would want our young people to have the skills to advocate or move those things forward.
Great, thank you. And then our next question kind of goes back to the legislature and if any of these health education standards are kind of not getting through because of the sexuality education curriculum, if there's kind of a link to that debate or if that's something that they're kind of shying away from.
I think in past histories, I think when you rewind time back into the late 1990s, that was the grounding basis for why those laws were put in place for General Assembly to have oversight. For us and OFERD and the health education teachers, we follow state law, which right now is absence only. But I will tell you that standards are not prescriptive to one side of that debate or the other. You could teach comprehensive sex ed standards aligned and skills based, just as you can absence only, and that should be decided at the local level. That probably shouldn't be decided at the state level, but it's not standards that are the controversial part. Standards will work for either approach, but I'll let my other colleagues chime in on that if they'd like to.
I would just echo Kevin's comments there as far as the House again, and you can even when you're, if you go this process, when you go this process, comparing what other states do. I mean, there are some states that simply take the 8 broad standards and say that's our state standards, and there's others that develop the specificity across various grade bands at grade levels. That's Ohio's decision as far as how specific those standards get and into which area. So again, it can cover that whole spectrum based on what the process comes through.
And just to piggyback on my original comments, we've taken the OFERD model curriculum and it's been applied public schools, private schools, the Archdiocese of Cincinnati actually took the standards and made their entire curriculum from it. And so I guess that if that's an endorsement, it is of the standards being, quote, non-controversial or being able to serve both sides of that debate.
And then our last question from the chat box is, what can we do here in Ohio to push through legislation that would allow or require health education?
Holly, you want to go first or you want me to? We won't put pressure on Jamie to suggest what we should do in Ohio, but for me, it's really understanding what standards are and what they do, and that local curriculum development process that actually Jamie's been really helpful in explaining about how the state provides guidance and support, and it's the local level that actually goes through the process of building the curriculum. So I think if folks take the time to understand what standards are, the skills within them, and the opportunity that a skills-based approach provides for everyone involved, is a really important piece of the puzzle. And so that's for me, get to know standards, listen, learn. I think once you learn about them, you're probably disappointed about how non-controversial they are, but yet we're really excited about how much it would help us as teachers deliver that skills-based curriculum that's going to have a positive impact on our kids. So Holly, anything else to add on that one?
I think the best part for me about health education standards is you can apply them to any content. And so again, health education is required in the state of Ohio, Alexis, so thank you for that question. It's how do we work on a coordinated, cohesive approach to how we teach health education? And that's really what standards give us is the how, and ensure that we're focused on attitudes and skills, which are oftentimes the most difficult, right? We know that knowledge sinks in, but when you actually need to change your health behaviors where the rubber meets the road is having those skills. And wouldn't it be great when you have to meet with a nutritionist or you have to meet with someone about your diabetes, if you have that foundational skill that you can draw from about behavior change and accessing information, then we would need less visits with that nutritionist or less visits with that physical therapist, because you would already be able to advocate yourself because you've been doing it since kindergarten, right? And so I think that will free up a lot of our allied healthcare provider colleagues because we've built that strong foundation through P12 Health.
And I think health standards would also create awareness throughout our schools and community that health is important. One of the things that I shared early on is that if you really look at the state of Ohio, we're getting one semester in 9th grade, and that's it. And I don't know of anybody on this call that would say that that's good enough for kids to be able to learn how to be healthy throughout their life. It's just not. And so I would think that the push for standards would reignite our families, our communities, and our schools to teach health education from a K-12 approach and look for those opportunities, not just in health education, but throughout the curriculum, whether it's co-curricular or extracurricular, to really unite and align around those skills that we really need. So that would be the other piece that I think standards would do for us.
And for those of you who work with youth and young people, ask them what they want, right? And so if you have the ability to have them get involved in efforts, I think that's always a good thing. Have them schedule meetings with their representatives and have them tell their side of the story, because they're the ones who this impacts the most.
And then going back to past legislation that has been introduced in past General Assemblies, I know that we saw that Rep. Liston's previous legislation was mentioned. How would that piece of legislation fit into the health standards framework that we discussed today?
Most recently in the Senate, we had a bill from Senator Sykes and Coonsey that I think made it to Senate Education. I think it made it through 4 hearings, and I think we were close to almost getting out of committee. Rep. Liston's bill, we had a couple hearings on that one. I think we had 3. And again, we're hopeful that in the near future that folks, as we get a chance to share within committees, we build relationships with staff members and lawmakers, that they begin to understand what standards are. So that was the last effort. And I think both of those bills are pretty aligned to what we would need to make the magic happen, so to speak, with the health standards.
All right, and then the last question that we have here for now is if you guys could walk us through the model curriculum that has been developed, and how exactly does that enhance local control?
Kevin, you're muted.
Sorry. So if we can go back to the model curriculum slide, like 2 back, if you can share it, but if not, I'll talk real quick. It really includes an executive summary as if you were going to go through a professional development workshop with one of us, with your teachers. So it gives an overview of that process, but really it includes learning outcomes. And our outcomes are standards, which are those K through 12. What's going to happen by the time I leave high school? What are the skills that I'm going to have? What are the learning outcomes that are going to be achieved? But then we also break it out by grade band, which is K2, 3, 5, 6, 8, 9, 12. And then we also go with that grade level indicators, which are really for our teachers really helpful. It's almost like unit or lesson plan outcomes that are arranged by topic. So we do eventually drill down to topic, things like mental and emotional health, alcohol, tobacco, and other drugs. So you'll see indicators that are specific to those topic areas. And it's aligned with what we typically see. The CDC has a HECAT model, which is the Health Education Curriculum Analysis tool. It's really aligned with that work. And from there, once we learn what our learning outcomes might be, you see districts try to mold and shape what they're going to teach in their scope and sequence. So what topics in what order and what emphasis are we going to give these outcomes in each of those topics? And they really go through that detailed process. And I would tell you typically that process to dig into the learning outcomes in the scope and sequence is probably going to be a year-long process where folks really dig in multiple meetings to think about what we do and how we align our learning activities to achieve those learning outcomes down the road. And then we think about how we would assess it or measure it, to show our progress within it. So really in that model curriculum, there's an overview of how to do this work, but then there's also those 3 big elements, which are learning outcomes, scope and sequence, and a little bit about assessment, but those assessments would be developed locally.
All right, and then I think we actually just have one more quick question. Are there any budget opportunities for these standards to be created?
For me, I think one of the things when we think about budget, and it's tricky because we don't support schools to go through this process, and we haven't supported the people who will be supporting districts to go through that process. So we've dictated topics and things schools must do, but we've never supported professional development and folks to do that work. It's been a skeleton crew of various state agencies trying to help districts meet what is suicide prevention or to meet whatever it is that's out there. So we've never attacked it because we haven't had the standards to guide who is going to do that work, or an organization to do that work, whether it's a university or whatever it may be. Does the budget provide an opportunity to fix some things? Possibly, but I would hope that we could get a bill through the regular process and have all those hearings and have good process to have a good product that is Ohio standards. Holly, did you have anything else to add in terms of opportunities within the budget?
Nope, thank you.
I think we've dedicated resources to help promote healthy kids. I think health education is probably a blind spot that may be out there. We have not supported health teachers and local districts to develop their curriculum.
All right, well, thank you guys so much. There are a few questions left in the chat, so we'll be sure to follow up on those afterwards, but I'm going to pass it back to Representative Smith right now.
Thank you, Hannah, and thank you to all of the panelists. So as we close, I just want to underscore the point that was made that Ohio remains the only state in the entire country without health education standards. Unlike other subject areas, Ohio students are required to learn, such as math, English, language arts, science, and physical education. Health education is the only content area without standards. This means that there are no clear learning outcomes for health education in Ohio, and it means that school districts lack the necessary guidance to provide high quality health education driven by their own local needs and community values. I appreciated the conversation about how we can align learning standards and outcomes with an actual curriculum that is determined by local communities. And I think that a big part of this conversation is constantly working to dispel misinformation that's out there about what can be taught and how it would be determined. And so I appreciate the expertise and the conversation and look forward to seeing all of you on a future Children's Caucus webinar. Thanks a lot.